In 1975, the Sisters of St. Joseph took my family in. They were refugees and from Vietnam to the US. And so before I was born, the Sisters of St. Joseph took my family, the refugee family. And so a year, probably a couple months later, I was born at St. Joseph Hospital in Orange. So it's actually one of our hospitals. So 30 years later, I end up becoming a sister, one of them. You know, so the first thing I did when I came to St. Joseph Hospital was to bring all of the leaders in our different ethnic community, in our API community, kind of bring them all in. A part of it, what I've experienced from the Korean community, Vietnamese leaders, Chinese leaders, Cambodian leaders, and you know, still need to work around the Asian specific Islander community as well, that they have been invisible. And the past 2 years that I've worked with them is advocating for them, is the inequity in our community, that they don't have a voice at the table. And so a lot of the work that I have been doing is uplifting our leaders, building trust with them, because what they have experienced is that they have come to our mainstream doors, and yet they have closed on them. And so now they feel like they have to survive by themselves. Well, so the first thing, because I've been working with our API community these past 2 years, I at first is like kind of looking at the health of the community. And immediately when this pandemic happened, I knew that they don't have the support system. So right in the beginning, that I reach out to them and say, what do you need? What kind of resources do they need? And you know, I was able to get not homemade masks, but masks for them, ordering for them. So specifically paying attention to our API community, because they needed that attention while there's so many things that was going on in our community. But yet, you know, they did not have anybody to pay attention to. That's the very beginning of the pandemic, and slowly people started helping. The only history that I have read about was when the Sisters, our religious community, in 1918, the reason why they came into healthcare was the flu epidemic. And you know, a lot of people died, and they risked their lives to be there with the people. And what we're doing is, as you see, the COVID pandemic that's going on right now, the anti-racism that's going on in the community, and people are more out there expressing that they don't. And I think what's the problem with us, for example, with Trump saying that, you know, this is a Chinese virus, and then all of us, right? It doesn't matter if you're Chinese, you're Vietnamese, you're Korean. We're all lumped into it being Chinese, you know, under that category. And yet they don't understand that we are different ethnically, culturally. And so that's all of this discrimination, racism, these gaps is because like people don't understand, and it's easier to lump everybody together. My hope is that we continue to learn about different culture, different ways of, you know, care about our community. For me, you know, if I did not do this work around the Asian American community, I would not see the gaps, the need. As from there, like I got engaged civically, I got engaged in areas that I know that can make a difference. So I hope future generation, you know, break away from your peers and take that risk, and knowing what's going on in our community and start advocating, because we all need to be a part of this journey together.